And what we found was really kind of two different ways that you could kind of think about the culture of HIV care. So at some of the sites were very socioculturally attuned. So at these sites, they were having conversations with patients about their transportation, their housing, problems with gambling, interpersonal violence, these conversations with patients about their lives, and then using that to think about treatment planning and problems taking medications. And then you can contrast this with the other sites that we would call kind of very individually focused, where the provider's thinking about the individual patient is either a good person and takes their medication or a bad person and doesn't. And I think what's really key here is because we had data from the larger study that was looking at the organization of care. One thing that was different about these sites that were thinking about individual patients is we also had individual providers. And so those individual providers pretty much worked by themselves. They didn't have integrated mental health within the team. They didn't have social workers on the team. And so you can imagine if you're one of those providers having an adherence conversation with a patient, you only actually want to hear that they're being a good person and taking their medication, because if they start telling you about problems with transportation and problems with housing, and that person as an individual provider, now they're kind of in a pickle. What do they do?